Bom dia a todos e todas que nos prestigiam com sua presença. Good morning, Professor Triester. It's a pleasure to receive everyone here. As you all know, this year our School of Dentistry celebrates 125 years of existence. And I am very proud to be here at this moment, being part of this history as the first woman dean of this school. Since May, we have celebrated this year with academic, artistic, and recreational activities. We are very pleased that our course of dentistry is among the best in national and international rankings, and we have 10% of the most relevant researchers from our university. I have to thank the coordinator of our postgraduate program in dentistry, Professor Cassiano Rezi, and to Professor Manuela Domingues for organizing this meeting in honor of our School of Dentistry. I would like to thank Dr. Nathaniel Simon Triester for so kindly sharing with us his knowledge about how and why to become a journal reviewer. We are very grateful for this opportunity. Thank you very much.
Nathaniel Triester. Thank you for being here at the Federal University of Rio Grande do Sul. We give you a warm welcome. And in the name of the research office of this university, we're very happy to have someone with such a strong background. And I am sure this talk will provide a lot of information with regards to review of important dental journals and also medical health journals. Thank you very much for being here.
Good morning, everyone, and it's indeed a great honor and pleasure to be here today to celebrate 125 years of our dental school. The Oral Pathology and Oral Medicine group would like to warm welcome Professor Nathaniel Triester. He's professor at Harvard School of Dental Medicine and chief of the Department of Surgery, Division of Oral Medicine and Dentistry at Brigham and Women's Hospital in Boston. Professor Triester is not just a distinguished academic, he's a global leader in the field of oral medicine. I would like to thank our Dean, Professor Susanna, for all the support, not for just this activity, but for all the activities that we have been having here at our dental school. Also, Print Caps, our graduate program in the name of Professor Cassiano Rezi, and the other two programs that participate with us of this grant, the graduation program of Child and Adolescent Health and graduation program in medical science area. The lecture of this morning is entitled How and Why to Become a Journal Reviewer. So Matt, once again, thank you for being here with us during these 2 weeks and sharing with us all your knowledge, your generosity, sharing, and your experience in the field of oral medicine have been modifying several aspects in our practice, and our collaboration is very important to our university. So we are very excited to hear from you what do you have to say, to share with us. So please come here, the stage is yours. Thank you, and I appreciate the presence of all of you. Thank you.
Thank you very much. Good morning. It's really an honor to be part of the celebration. 125 years is a big deal, I think. It's a big deal if you're the dean as well, but 125 years is pretty amazing. What is the oldest dental school in Brazil now?
Bahia,
Yeah? How many years do they celebrate?
130.
Okay, a little bit more, but not much.
Yeah,
Yeah.
5 years more.
Yeah, it's really impressive. And as I've, just in the last week, learning so much more about the program. I mean, I was here for less than a day a year ago, and it was all focused on research. So I really didn't have much of a chance to learn about the program. But the fact that, learning more about it is very impressive. So I agree, it's going to be very nice to continue and build on the collaborations that we have.
Just this.
What?
Just
Only this one is working.
yeah.
Only this one?
Yes.
Okay, we'll forget about this one. But, okay, then I don't go like this. And I look forward to this talk. It sort of is going to involve a lot of information, as you can imagine. I mean, why and how to be a journal reviewer. Also, nobody can consider being a journal reviewer if they haven't published. Nobody can publish if they haven't thought about study design. So all these things end up sort of tying together. And I hope that sort of the story that's told through this talk is fairly clear and doesn't seem like too scattered, because there's a lot of interesting concepts. And like most talks, for this audience, it'll be at somewhat of a higher level without going into too much detail on one specific point or another. But hopefully you find it interesting. And the other thing I would say, just as far as sort of introduction to the talk, why, how to be a journal reviewer. So I spent, I think we talked about this yesterday, I spent probably over an hour to an hour and a half yesterday reviewing, editing a paper that I am a co-author on. But I'm a middle co-author. So from an academic rank standpoint, academic currency standpoint, in the United States, and especially at Harvard University, you get a little bit of credit, but you don't get a whole lot of credit for being a middle author. Your first author or your last author, or you're designated as co-first or last. But if it's something that I take very seriously, I mean, if I'm going to be an author on something, I'm going to take it seriously no matter what. But if it's a content that I really care about, I don't really care whether I was the third, fourth, fifth, seventh author. I'm going to put the time into it, or I'm going to say, you know what, you don't need to include me as an author. So I spent an hour and a half going through this paper, and I probably have at least another hour to be able to continue to do the editing at the level and quality and sort of focused intensity that I need to for myself to feel like I'm doing good work. And a lot of my comments to the author so far, like even the abstract section, like the abstract almost shouldn't matter. Like as a middle author, the abstract that's going to be submitted, like it just doesn't matter. It's not the paper, right? I mean, nobody gets an A or an F based on your abstract. It's what goes into the journal. Maybe when you're reviewing the paper, a reviewer actually spends time giving feedback and making sure that the abstract actually represents what's in the paper. But it's really not that important. But just going through the abstract, it probably took me 15 minutes. Because when it got to the conclusion section, there were like big, broad, sweeping statements. You can do that a little bit in the discussion section. But your conclusions in an abstract are simply, this is a piece of paper, I called it brown, and I put it on the table, and it stayed on the table. And my conclusion is that we identified a brown piece of paper that remained on the table. In the future, we may need to study this in more detail. I can't say that this brown piece of paper is going to become the next president of Brazil. Even if I think it's the smartest, most ambitious piece of paper I've ever put my hands on, I can't say that, and you can't say that in your abstract. So my point is, in reviewing this paper, it was driving me crazy because if I were the reviewer to get the paper and I just started with the abstract, and I don't even know the content. I mean, I know the content because I'm part of the group that did the work, but I would just be reading it critically, and I'd be reading it and thinking, this is just written in an awful format. And if the abstract is awful, what's my bias and opinion going to be when I start the introduction, let alone the methods, let alone the results? So there's some, like I said, I mean, I could almost just talk off the top of my head for this talk because every slide connects to another slide, but not even necessarily in a linear manner. It all is just like a big circle and it's bouncing back and forth. But I think one of the first slides will actually be 2 papers talking about essentially writing for the reviewers. And that's the way I always do. So when I'm working on something, I just think like, imagine I'm reviewing this. Like, is this clear? Is this written well? Is the flow logical? And if there's something that's off, just keep working on it until it's better. So, and on the flip side, how to be a journal reviewer. I had a resident, one of my former residents who's done very well, was in one academic position, is now in another academic position, I would consider even a better academic position. And her work is going very well. And I ask her to review a paper every once in a while, and I never try to lean too hard on anyone. And it's, you have to be careful as in a leadership position because even a former resident may feel somewhat obligated, depending, so you don't want to manipulate your relationships too much. But, and she's a good reviewer, and I've sent her, and she sent me an email the other day saying, can you please remember to, include me in more reviews? Really? Thank you. It's not easy to, it's tough. And I, for a couple of journals, work as one of the associate editors, so it comes from one step above. Now you have to go and find all the reviewers. I don't know that this was easy 10, 15 years ago necessarily, but I think it was easier. And everybody's just gotten so much more distracted, so much busier. Just the digital world has made everything faster and more intense. And there's, even compared when I was in dental school, I graduated dental school in 2000, and I don't remember the numbers off the top of my head, but I would have to guess that there's 100 times more journals than there were back then. I mean, they're like multiplying. And some of them are actually good. And so there's just more and more demand on reviewers. So it can be really challenging. And it can also be tough because you look for reviewers and sometimes you're going to your 4th, 5th, 7th, 12th, 20th option. You don't necessarily really know who the people are. There's systems in which you kind of have some sense and they help you, but you've got to, and you can't always just lean on some people have a massive network, but at the end of the day, your network is only so big and you can't just keep asking people to review papers. So I've included the slide now. I know there's a couple of people that weren't at other talks, but just to give a sense of where I'm from, where I work, where I live. So this is the northeast part of the United States. And you see Boston, Massachusetts. But I also mark a couple of other locations where I and/or our service provide clinical care. So much further up north in New Hampshire, where I've been practicing once a month for about 6 months now. We also have another practice. It's about an hour, maybe a little bit more than an hour south of Boston, where we see outpatient oral medicine standard outpatient oral medicine patients. And then in Boston, so any of you who've been to Boston, you might somewhat recognize we're looking from the west, sort of to the east, where the downtown part of Boston is, and then the ocean or the bay here. The dental school, the medical school, my hospital, Brigham and Women's Hospital, the Dana-Farber Cancer Institute, and Boston Children's Hospital, let alone the School of Public Health, another Harvard hospital, the Beth Israel Deaconess Medical Center, where I see patients will be referred from there to our service because there's no oral medicine there, is all in this campus, which is pretty crazy. It's a really packed area. And all of these Boston Children's Hospital, Brigham Women's Hospital, the Bethesda Deaconess Medical Center, the Farber, every one of these institutions has satellite locations because everybody is, even though there's more building going on along the medical area, everything is totally outgrown. And you can imagine that the traffic is horrible. If there's a baseball game, like the US baseball, it's right near there, and everything will just stop. Okay, so two really good papers. And so what I always found to be my favorite thing, so there's a lot of ways a talk can be good. A good talk, sometimes you don't even know why it's a good talk, but you just realize that you're not checking your phone every 5 to 10 minutes or even every 2 to 3 minutes. Immediately you know that's a good talk, especially if you're at a conference where you're going to be in a room for 6-8 hours for the day. You're going to check your phone a number of times. You're going to take bathroom breaks. You're going to whisper to your neighbor. You're going to doodle. I mean, you're going to do things. You're not going to sit there and listen all day. But you may have 3 talks in a row, and 2 of them you're sort of. So even if I need to, I think back, before it was cell phones, I would have a piece of paper and I would just write down the reference. That's it. I wouldn't write down anything else. Name, year, whatever they gave me, and then I'd find the paper. I would never wait more than a day or so after I got back, so it didn't just become like a little, like all the business cards you have sometimes. You're like, should I email these people? You just like do it quickly, get the paper, and and read it. Same thing for like finding really good figures. You go to a really good talk, and you just see this figure and it's referenced. God, that's amazing, and then you use it. And sometimes I use a figure like that, and I'll acknowledge it in my talk every time. Especially if it has to do with the author, and if I know the author. So, point being is, there's a lot of good references in this talk. So even if you fall asleep at some point, there's really good references, and these 2 are fantastic. They're from the Journal of Clinical Apheresis, so it's a hematology journal, but these have nothing to do with hematology. And you can see the first paper is how to write a manuscript for peer review. If I spent, months trying to put together a paper like this, it wouldn't be written as well because, this person's an expert. And again, I have to look at your screen closely because I know you won't be able to see that well either. But just to read the abstracts on these because they're really informative. So it says, writing a manuscript for peer review is an art for which writing a manuscript for peer review is an art for which little formal preparation is provided during the education of physicians, scientists, and allied health professionals. At the same time, publishing their work may be central to their career ambitions. This article provides an explanation of the purpose and expected content of the components of a peer-reviewed manuscript and advice regarding how to go about writing one. It aims to somewhat demystify the process of scientific writing and render it accessible to more members of the American Society for Apheresis, but for your university. It's nothing specific. And then the next paper in this series is, you can see, it's just like, it's hand in hand with the first paper. It's just called Surviving Peer Review. And here, if my eyes will work, they say, process of publishing original work in a peer-reviewed journal is not complete at the point where the manuscript is first submitted. The journal editors will submit the manuscript to peer review, whereby outside experts are asked to vet the manuscript for scientific merit, originality, and quality. Reviewers' comments are meant to help authors strengthen their manuscripts for potential publication. Authors benefit from this feedback and should approach the reviewers as volunteer consultants rather than as critics. Authors should respond to all reviewers' comments completely and politely, addressing the points raised. This article is meant to assist junior or inexperienced authors to understand the process of peer review and to function effectively within the process in order to succeed in having their manuscripts published. So everything that I could possibly tell you about, if you read these two papers, It's not going to talk so much about study design, so we'll talk a little bit about that separately. But really phenomenal papers, right? And you know, recent 2020. So it's also the fun thing about a talk that you give, but then you're sort of forced to maybe like tighten the screws a little bit, update, make sure that maybe there's something better to add. I mean, the last time that I updated this talk was probably sometime before 2020, and all these papers came out. So you never know what you're going to find. So this is a really nice figure from another article about reviewing and how to be a good reviewer. And I think I like this one because this one puts the reviewer at the center of the figure. Because as a reviewer, you're not central. You know, like within the whole process, you have an important role. But I mean, you don't really consider yourself the center of the activity. It goes to you, it comes back to you. I mean, it goes to you, it goes back. Maybe you don't have to touch it again, especially if you said like, you know, this is a piece of crap, I'm not willing to look at it again, but you spent time reviewing it. But here it really shows like, as a reviewer, you have an important role. We already heard in that abstract, the role of the authors, you know, you're actually sort of working like to help them, not just to be critical or to be cruel for some reason. You want to give like clear, structured feedback. And especially when the paper really has potential. A bad paper is a bad paper, and it can be really frustrating to review. And I've gotten to the point when I review a bad paper that I actually give very little feedback because it doesn't deserve the level of feedback. Because you're already going to say that it should be rejected. You know, my personal opinion is if a paper should be rejected, it doesn't demand, you know, 3 hours of written, you know, review and feedback that some papers may actually demand if you really feel like you're doing your job well. But when it's a decent paper, you potentially are going to make the paper better, and you'll get the feedback sometimes from the authors and their response, you know, saying thank you. Like, this was so helpful that you pointed this out, and we believe that whatever is much better because of. And I've seen that many times. The reviewer is also working directly with the editors, of course. I mean, you're working directly under the editor. The editors are going to expect you to do your job. So, you know, you accept an assignment, and they want it in, you know, 10 days or 20 days or whatever it is. No, everybody can't meet every deadline, and at the end of the day, we're volunteer consultants, as was noted. And when you're a volunteer consultant, you have to give a little bit of leeway. But you know, you also need to communicate well because ultimately it's the editor that's going to be your messenger. And the editor has a name. At least today, and we'll talk a little bit about different approaches to peer review, most peer review is single-blinded. So when you're reviewing, you know everything about the authors, which I think is good. I mean, if someone says that they did this, this, and this, and you don't actually know who they are, where they're from, I mean, it helps to know a little bit about where the paper's coming from. But most papers I would not review if it was not blinded, because it's just too much of a liability. You know, like I think we're friends. I think we can trust each other. I know we published some papers together 5 years ago, but now I'm going to openly review his paper and potentially say that there's fatal flaws to it, and then we're going to go have a barbecue later. You know, like, it doesn't feel right. So, but at the same time, there's not necessarily a conflict of interest for me to review his paper. Just because he's either superior to me in the institution, or I know him, or even that we published together in the past. Those are not hard rules for recusing yourself. So you have to make a decision yourself, you know, am I comfortable doing this or not? But I do it all the time, you know, and that's the beauty of it being single-blinded, is to some extent, it's like you share your dirty laundry with the world. And either you're gonna share it, and you think it's not that dirty, or you're gonna make a fool of yourself. And it happens both ways, you know. I review work from colleagues, and it's like, I'm not biased to want them to have a good paper, but I just read it. This is really good. Or I get something and it's just like, what is going on here? You know? but again, it's all personal. You have a relationship with the journal itself, so presumably you care about the journal to some extent if you're going to agree to be a reviewer. Some people are, on a reviewer's like on a list, but other people may just be asked sort of more on, we say, an ad hoc manner. But even then, like when I say yes to journals, it's almost always going to be a medical journal, and always a medical journal with some real legitimacy. And when I get asked to review something like that, as long as the ask is appropriate, it's really hard to say no. Because, I know that in that case, like in the grand sort of universal scheme of things, I'm doing my part to make the system work and be better. And I know there's only so many people when I get asked to review something very specific in a specific type of journal. There's only so many people that are really going to be able to review it well. So on the flip side, when I get asked to review something, and it's like anybody with oral medicine education and knowledge could review this, I have to say no, because I don't have the bandwidth for it. And then finally, of course, the readership, right? So when you're reviewing, at the end of the day, you're doing it because this is a manuscript that may get published, and ultimately, I'm part of this community of readers. And you want to know that it's actually a legitimate process. It's been done well. The paper is going to be readable. It's intelligible. All these things. So I think I kind of put this slide up as probably a pause point, but I tend to talk a lot anyway, so I think it's obvious. Why does all this matter? So again, another nice paper. And this is just walking through the steps in submitting. So you have a manuscript, you've written something, probably with a team of people. Somebody has primary authority. It's usually going to be whoever the first author is. Probably if it's graduate students and professors, the lead graduate student will be the first author, and your supervising professor will be the senior author. But you have obviously just the work that needs to be done first. So in this sort of initial phase, you've done your research, you do your manuscript preparation, you have to do internal review. So I'll say that another thing I get a little frustrated is when I'm a middle author. I get asked, we're really happy to include you as one of the authors, like this paper I was talking about that I worked on yesterday. And you have some very prominent people on the paper, and I figure, I'm just going to be looking for is there one or two little details about something that I particularly can add, knowledge base to, that I can help make a little bit better? And like I said, and I'm stuck on the first sentence of the abstract. That's really frustrating to me. But it points to that first phase. It needs to be done well, and ultimately you submit to the journal, and you have all the components that are necessary. The journal will receive the manuscript. They'll give some sort of acknowledgement, and there's some sort of quality check. Most journals now also look for plagiarism, so there's all these just algorithms that they run through, like plagiarizing a thesis and things like this. But it happens. And then it goes to the editors, and the editor will review for quality. Is it relevant? Is it significant enough? Sometimes the editors will rely on the associate editors who have maybe more expertise in a specific topic, even to make some of these decisions. Because I've gotten papers before for some journals, and I said, do you really, I'm going to have to ask people to review this. And I just don't see how it's not going to get rejected. Is it really worth sending this out? And then the editor will be like, I wanted your opinion on that. Okay, I don't think we should waste our time on this one. Here's why. But ultimately, they're the one that makes the decision. So nobody's ever getting an email from me as an associate editor from Nathaniel Triester saying, essentially, sorry, your paper wasn't good enough. So I don't have to deal with the wrath of people then responding and being like, oh no, here's why it's so great. That's what the editor deals with. And to date, I have not served as an editor. I don't really know how I would have the time and energy to be an editor. But it would be kind of fun, but also it would be really frustrating, I think. So then there's peer review. That's what we talked about. So now it's going to go out to peer review. And then again, there's usually another level of editors who are responsible for doing that process. And the peer review process is going to be reviewing for pretty much everything, all the things I talked about. You know, study design, methodology, just significance, readability, flow, all these things. So, and generally you're going to be asked that either should it be accepted, should it be rejected, or should there be minor or major modifications, revisions. And no paper that gets submitted for the first time should be accepted. I mean, if you're a good reviewer, you have to have a few things, even if it's really good, that you would strongly recommend the authors consider addressing or modifying. So it would be a minor revision, which is not a big deal at all. The editor then, though, is the one that makes the decision. So they'll review what you've submitted. It goes back to the authors. They will submit. They'll submit their response to the review, which we'll talk about in a little bit. There'll be revisions. Sometimes it's more than one set of revisions, and ultimately the manuscript is accepted. As authors, you get proofs, and you go through and you make sure everything's correct, and then you have a paper published. It's really easy, right? So I talked about bias a couple times. There's so many ways in which bias need to be considered in every aspect of research and publishing. So, and I'm not a bias expert, and I'm not going to go through every possible way in which bias sort of slips in, but just figure that from the standpoint of who is writing this paper, what have they done before? How are certain things being interpreted, even from the standpoint of the basis for the research that's being proposed and has been performed? There's so many different ways that bias can affect the design, the quality, even the interpretation of results, and that's on the authorship side. Whereas this slide is really talking about bias from the standpoint of a reviewer. So, I said that I think that single-blinded is a good thing, but it also opens up the door for a lot of bias, because it means that, again, like I said, I may have expectations about an authorship group just based on the name, based on people I know, based on work that I've done with them, and to some extent having that sort of upfront bias has some influence on my approach to my review. And you have to acknowledge that, and you have to find ways to really try and separate yourself. But from a reviewer standpoint, it talks about ego and cognitive cronyism. So it's sort of this the sense of I know better, I know more. You see that a lot in reviews. Sometimes the way in which the reviewer writes and submits their comments, it comes across as very sort of I'm better, or how could you not know this? Things like that. Like in anything in life, there's potential confirmation bias. And so, you could argue that, oh, well, if it's similar to work that you've done and you like it and you think it's good work, you're just gonna be more accepting. Or if it's something that's a little bit more against the grain, challenging, a little bit more provocative, and there's story after story of this in human, in the advances of science, where something that ultimately is not only correct but changes the world, right, initially is thought to be worthless. Conservatism, so same thing, just kind of holding things back to some extent. Potential conflicts of interest that haven't been identified and or not really acknowledged appropriately. So they're all things that need to be considered. And then this is a really nice table that outlines a blinded versus an open review, and a double blind versus a single blind, which again is the standard. The standard is single blind, but there are double blind and there are open reviews. I've never either agreed to or been involved in an open review. I've been involved in a few double blind. But again, I think for the most part, I don't think that the system is going to change drastically. There are advantages and disadvantages, but I think the single blind works pretty well. So again, everything you want to know, you can read this paper. The title is How to Peer Review a Medical Journal Manuscript. So now we know a little bit about sort of the how, the why, a little bit of what. Now this is, okay, you're gonna do a review, what do you need to do? So some nice tables from this paper. First one talks about qualities of a peer reviewer. Pretty obvious, you know the subject. You don't necessarily need to be the smartest, most experienced person, but you know the subject well. You're willing to spend time and be thorough, really important. Getting a really curt, short, almost worthless review from someone is incredibly frustrating, and it's unfortunately it's not that uncommon. And if you limit yourself to only 2 reviewers, and I'm sure anyone here who's been in an editor position has had this experience, you get 2 reviews. One of them is, maybe a whole bunch of comments, pretty detailed, and reject. And the other one is 1 sentence. This is great. I really commend the authors for the work they did. Except, that's not a review to say this is great and I commend you for doing the work you did. And it also puts the editor in a complete bind because you know that it's not good. If somebody was willing to spend the time and have a more detailed review and say that it should be rejected, maybe it's at a major revision, but there's no way this is to be accepted. And then you maybe have to go and ask for another reviewer, but to do that you may have to ask 10 reviewers for one to say yes. And then, they're just coming off of vacation, so you've already put this review process that was supposed to be 2 weeks, already got extended to 3.5 to 4 weeks, and now you're going to add another 4 weeks. And then the authors start getting upset and asking the journal hey, what's going on with this? So it's it can be a little stressful. Steps in evaluation. So you're going to go through and this is why I was just you've got to just read through the paper once. Maybe not even in so much detail, but read through it. Maybe take a few notes. Make some notes about what is this paper about? Have they actually made it clear? What type of article? What type of study? And then reread as often as necessary. I mean, you're going to kill yourself if you reread over and over again. But I think every review requires at least two reads. Unless it's just that easy to go through the first time. And ultimately, you need to determine, where are the real either problems or areas where if some attention were put to this or this or this, that the paper could be that much clearer, that much more effective in accomplishing what it's trying to accomplish. And then the last table I included here are reasons for rejection. There's a lot of reasons to reject a paper. I mean, one thing to consider is that most journals, they're going to reject many more papers than they accept, or there's a problem with the journal. So as someone reviewing, you have to recognize that probably more often than not, you're going to reject a paper. And that's not necessarily a bad thing. But there's potentially flaws in how the work was interpreted or presented. But I think a really important one is number 5 here, where it just says flawed study design. Because that's a really important one, and we'll talk about that a little bit, and why it's so important to actually think about study design, to think about what your results might be, to think about how you're going to potentially present those results before you even start the study. And whenever possible, including a biostatistician, I just think is one of the most essential things in writing any manuscript. So many people try and do it without one. From my standpoint, the more authors, the better in most cases. And again, if I'm first or last author, I'm never going to give away authorship for free. But if I have a paper with 6 authors or 20 authors, it makes no difference to me. There's no higher value or lower value based on that. Number 7 is a good one, poorly written beyond repair. That's you can't even spend time providing feedback. This is just, it's so poorly written. The good and the bad of that is of course, with artificial intelligence, we will get less and less of this, which only makes us more suspect at the same time of, so what exactly is this? And so I really like this table. So the table's title is High Impact Areas During Peer Review. So like, where are the areas that you really want to focus on? Like, is it helpful to the author if you spend a half an hour looking at the title of their paper and like playing a word game and trying to propose a cuter, better, like, more descriptive title? Probably not. Unless the title's just wrong. And I have had papers like that. You get a paper and say, this title is not, it's not accurate to what you did. So either something wasn't described correctly or the authors need to revise the title. But I wouldn't tell them what to write. But title obviously is important, has some impact. Abstract, like I said, it's it does provide a summary, and it's sort of what people will see first before they maybe go to the full paper and even decide to read the paper. So it should be good. And again, it's why I say wasted, but of course it's not wasting time. I spent all that time just reviewing the abstract of this paper before I even got to the introduction that I'm still working on. Figures, are they good? Are they clear? Are they sort of efficiently used with respect to what data is being presented in the paper or not? Same thing with tables. Introduction, I also feel strongly like it needs to be good. It needs to be concise. I think that's probably something that more feedback than anything that I provide for introductions that are not so well written is either like combining sentences well. So it's not just a single sentence, single sentence, single sentence, single sentence. It's just not a very efficient use of words. But more importantly is a really long, detailed introduction. There's no hard rules to absolutely follow, but I would argue no introduction should be more than 3 paragraphs. Most should be 1 paragraph. Some can be 2 paragraphs, but most should need to be 3 paragraphs. And it's we say like an inverted pyramid. So you start broad, and there's just a few basic steps. And it doesn't need to go really far outside of that, and it should take you right to the objective of your study, and that's it, and then you go to the methods. There's no interpretation, there's no like hyperbolizing in your introduction what the significance of this study was. It's just, here's where I started, here's what's important, here's what we don't know, and here's why we did this. And it's that simple. And it can almost always be done in 1 paragraph. And it just makes the paper better, because papers don't need to be long to be good. Methods just need to be clear. And I'd say that one thing in methods, so a couple things. One, they need to be clear. They also need to be complete. So sometimes methods are just missing details. Or you see something described in the results where the methodology wasn't described. So you have to think really logically when you're reviewing. Sometimes it's just connecting dots to some extent. The other thing in methods that, whether I'm writing a paper, editing a paper with colleagues, or providing feedback as a reviewer, there's a lot of papers that will write a long methods section with no subheadings. So having a subheading of study design, patient cohort, procedures performed, statistical analysis, like just to have that structure, even if all you do is add subheadings, so you make no change to the actual flow of the paragraphs, for the reader, for the reviewer, everything becomes a lot more clear and the flow is a lot better. But more often than not, by doing that, it actually forces the authors to realize, oh, like, this is kind of sloppy, like, why is this here? That doesn't really fit under that topic, it's under this topic. And I can't really introduce this if I haven't talked about that first, so this should go there. It just requires a little bit of construction. And oftentimes the methods is almost written like a stream of consciousness. Like, I start here, I end here, and that gave her enough information. Results obviously need to be clear, and again, should be efficient. So use of figures, tables, the written results. And then, within a discussion section, being able to really identify what the limitations are. It drives me crazy if you see a discussion section and there's a long paragraph talking about all the strengths of the study. Showed this, we did this, we had this resource, and then there's no criticism of the work. There has to be a balance. So just to break down a paper, because sometimes sections can get a little messy. You have a title, you have an abstract, you have your introduction, you have methods, results, discussion, conclusions. There are some journals, some of the sort of more really high-level scientific journals, right, where methods are put at the end. But most of the papers that we would be writing and or reviewing, it's going to go in this order. So, title, I think this is pretty obvious. And I would also say with a title, don't be cute in general. And now I'm talking more about writing than reviewing. But, there's a role sometimes, and if it's an opinion piece, maybe it's okay to be kind of cute with words. But for the most part, just be direct. And whatever the focus is, make sure that impact focus hits the paper first, not a whole bunch of words that don't actually have anything to do with the topic, but then the topic at the end. Because it's just from somebody looking for a paper, it's just, I can't even think of an example off the top of my head right now, but it's very common to see that. Or for the title to be like a pronouncement, if what you're describing is methotrexate ulcers in patients with rheumatoid arthritis, then find a way to say it as just concisely and directly as possible. I'll leave it at that. So, this is not necessarily the best paper in the world. This is not necessarily the most impactful paper in the world. But when I was putting this talk together at some point for residents in the last few years, I was going through papers of mine and finding, what's a good example of something that it's simple, it's practical, and it's a paper I like. I feel good enough about it. So I'm going to use this as an example throughout. So in this case, look at the title. An open label phase 2 randomized trial. Okay, you know exactly what it is from the start. Of topical dexamethasone and tacrolimus solutions. So even though we're talking about solutions, not just a topical treatment, for the treatment of oral chronic graft-versus-host disease. It's succinct. It's a long title, but it tells you everything you need to know without saying anything extra. Abstract, we've talked about this enough already that I'm not going to go into more detail, but some of them are structured, some are unstructured. And the example for this journal is an unstructured. I actually don't like unstructured because you can already tell probably from what I was talking about with methods. I just like there to be some order to things. But I won't go through this in any detail. But it's a clear abstract. It tells you exactly what the objective was. It tells you how we did the study. It tells you what the most important results were. And it doesn't try to say too much. So the last two sentences, intensive topical therapy with dexamethasone solution. Sorry, I'm speaking to the microphone. Just need my eyes to. Intensive topical therapy with dexamethasone solution is effective for managing patients with new onset symptomatic oral chronic graft-versus-host disease and should be considered for first-line therapy. Topical tacrolimus solution appears less effective, at least for first-line therapy. But we don't say anything more than that. It's just, that's what we showed. What about the introduction? So we talked about this already. I even said 1 to 3 paragraphs already. And so this is the introduction, the 2-paragraph introduction. Maybe a little longer than it needs to be, but not too long. And this is sort of how I broke down without me reading through it, the elements. So I start out and basically in the first paragraph, it's not transplant has changed the world. Because I'm not talking about transplant changing the world. I'm talking about patients who undergo transplant will frequently develop GVHD in the mouth. That's my starting point. I don't need to start in the universe and then get to the mouth, and then get to topical treatment, and then what we don't know. So I start right out, the first sentence, oral chronic graft-versus-host disease. And then beginning the next paragraph is there are evidence-based guidelines that recommend whatever. Next part says basically here's what we know and here's what we don't know. And then finally the study objective. It's a logical flow. So methods, again, we've talked about this a bit already. It's going to provide all the detail that you would potentially need. And so here, again, I'm not going to try and, I won't even try and read this because they do their methods in a smaller font. But you can see, look at this, look at all the sections in the methods. I can't read to that screen. Selection of subjects, study design, study treatments, oral chronic GVHD assessments, oral biopsies, and statistical considerations and analysis. Huh? I know. And then, I just added this slide this morning because I was on a Zoom meeting with two of my colleagues, international colleagues, at 6 o'clock this morning, preparing for a course that we're going to be giving in India. And something came up around talking about study design, one of the talks that one of us is giving, and my colleague was sharing this. And I have this checklist saved somewhere. This is from a Saudi journal. She's in Jeddah, Saudi Arabia. But it's just the standard checklist. So this is the consort checklist. So anyone who's, most journals, you're going to report a clinical, some sort of retrospective or prospective clinical report. There are very specific elements that need to be included. And journals will check on this. And some of them will even ask that you submit the checklist. So you actually submit a document where you acknowledge each of these things and how and where and what way it's been included. And then you have this study flowchart, and it's provided by whatever the group is that put forth the consort guidelines. So you see the same figure in many papers because you just use the basis that they give you. So in results, is everything interpretable? Between text, tables, and figures. And again, everything shouldn't be overlapping. They should be sort of somewhat complementary. And you're going to go through and just look at it really carefully. And ultimately, to some extent, just, is it believable? You should be skeptical about everything. And again, is it organized in a logical way? Just like the methods can have subheadings, I find that results also benefit greatly from subheadings. It just generally makes the flow better. So this is an example from our paper, just some figures showing responses with a clear legend. Another clear figure that was showing systemic levels of tacrolimus in patients who are using tacrolimus topically. Again, a really clearly written legend and a clear, easy to follow figure. Clinical figure that we included, again, it's not really busy. I don't need a whole bunch of arrows. It's simple. Here's the clinical, here's an example of a clinical patient before and after treatment who actually had biopsies pre and post, which was not most of the patients. And again, very clear legend with reference to the different panels. And then finally, the discussion section. I think, some authors or groups of authors will use a discussion almost like to write another paper. And a good discussion is nice, but it should be really focused. Most discussions don't need to be more than probably 4 or 5 paragraphs. When you see a discussion where the paper itself is, like 2.5 pages and there's 4 pages of discussion, it's crazy. Like, no paper deserves that much noise because the discussion is just opinion, it's just thought, it's all derivative. Like, there's nothing of true value in the discussion section. The discussion is like, you know, did you comb your hair nicely? Did you shower? Are you dressed well? Because you're not being judged on the discussion. But the discussion should be, but it should be thorough. And like I said, you should be identifying if there's, you know, what the limitations are, why there are limitations, and so on. So here is the discussion section. And, you know, there's a few things I note here. So in the first paragraph, there's a little bit of sort of an overview summary. You don't have to start this way, but I find it's kind of nice. It's just a comfortable way to start a discussion. And then the next paragraph starts with sort of, you know, I'm setting up a discussion. So I say, despite the fact that the NIH consensus guidelines endorse the use of dexamethasone solution as first-line management for oral chronic GVHD, there's limited published evidence supporting this recommendation. And then you go through and you talk about it and so on. The next one I have highlighted, paragraph says, the effectiveness of topical tacrolimus for the management of oral chronic GVHD has been described in several case reports and series, but it's not been demonstrated in the context of controlled trials. And then I go through and I talk about that because that's what's unique about what we did in this study. And then I have this nice long paragraph that starts out, this study had a number of strengths and weaknesses, really obvious. Here's where we're going to talk about the strengths and weaknesses. And then finally at the end, I always start with whether there's a conclusion section or not for the journal. I, you know, always end sort of, you know, something that's like the wrap up. So in summary, like, and you should never be introducing anything new in the discussion. It's incredibly frustrating. You'll see like a new interpretation of the results, or a result that's described that actually isn't described in the results. So when I say in summary, this study demonstrated that topical dexamethasone, when rinsed for 1 month intensively, I mean really specific, not just using it, is safe and effective at reducing the symptoms of oral chronic graft-versus-host disease. Tacrolimus, albeit safe and well tolerated, appeared less effective when applied in the same fashion. Based on these results, and building on the results of previous studies, dexamethasone should at present be considered for first-line topical therapy in patients with previously untreated and symptomatic oral chronic graft-versus-host disease, and the comparator for future trials of novel strategies. Further evaluation of higher concentrations of topical tacrolimus solution is maybe indicated. So a little bit of speculation, but for the most part, just noting what we saw. And again, there may be a conclusion section, there may not be a specific conclusion section. So just a little bit about sort of study design, and then I don't want this to go, how long are we supposed to go until? Wrap up soon, I assume. I don't want to lose everybody on YouTube if it gets too long. We have primary studies and we have secondary studies. Within primary studies, you can have experimental studies where you're actually intervening, doing something, or you can have studies that are observational. And there's nothing that's necessarily inherently better or worse about one or the other. There's times and places where one is more indicated. If you all remember, you know, for any of you who are at the talk about head and neck cancer complications, and I talked a little bit about the ORAD study. You know, we've published, you know, how many papers now? We're doing the 7-year follow-up I talked about, but it's all purely observational. So there's no intervention at all. It's just observing what happened with these people. And again, really nice paper back from 2006. In this case, you can see this is a table adapted from another paper, so it actually goes all the way back to 1997. You talk about, you know, if you're looking for therapy, you want to really test the effectiveness of a treatment or a procedure, then ideally a randomized double-blind placebo-controlled trial would be your preferred study design. Looking at diagnosis and screening, looking at various tests and so on, cross-sectional work is very good for that. If you're trying to determine causation, like is this associated with developing that cancer? Then a cohort or case control study, depending on the rarity of the disease. Even case reports play some role. The case reports are case reports, and I'll show you in the sort of the hierarchy there at the bottom. Except for just basic expert opinion pieces. And if you're looking for prognosis, okay, based on this today, what's likely to happen tomorrow in 2 years and 5 years? Then you want a longitudinal cohort study that's being followed. And another nice figure comes from this series of papers from this group out of Lancet from 20 years ago. Again, was there an exposure or no exposure? If yes, it's experimental, no observational, and then this breaks things down really nicely. I think in maybe a little bit more like well-illustrated way than the other table, but they're both more or less pointing to the same concepts. And again, cohort versus case control studies and the importance of the exposure and time. And I would just pull these references and read them. You can learn so much from these papers. And then just recognizing, anytime we're studying anything, it's just a sample, and that sample based on our study design has a lot of bias built into it. So just recognizing that, even where your starting point is, it's not necessarily representing, all the patients with this condition. And then here is the study flowchart. You can see it looks exactly because you use that framework and you just put in the details. And it just, it walks through what we ended up with and why. A standard, what we oftentimes refer to as sort of the table one. So if you're doing any sort of clinical report, your first table is going to tell you who is the patient population and what do you really need to know about them to better understand whatever it is about the study that you're describing. Another great table. I have no expertise in this. I'm not a statistician. I never tried to become sort of an expert. I have enough of an understanding, but I work with a statistician. But I think just from the standpoint of thinking these things through and understanding what different tests that we have and why we have them, again, really nice. I mean, this reference from 2006 is a great paper. And then I think we're just about at the end. But I think this is also an important concept that we don't necessarily think about all that often. It's just phases of clinical trials. I serve on one of the IRB institutional review boards at the Dana-Farber Cancer Institute, and so I see we don't do anything preclinical because it's all human subject research. But I oftentimes am reviewing protocols that are first in human phase 1. So has never been tested in a human before. Phase 2. So phase 1 is purely for safety, especially in certain settings, like in the oncology setting. You're always going to look for some preliminary evidence of efficacy, not just safety, but it's primarily for safety. Phase 2, you're looking for efficacy. It's not going to be definitive. It's a small randomized trial, maybe looking at 2 different doses without a control. And then if the findings from phase 2 are sufficiently positive, then you move to phase 3, and that's a large randomized controlled trial. And you want to confirm phase 2 findings in this case. Phase 4 are studies that happen after an approval or marketing. But from the standpoint of drug development and discovery, you start with a huge number at the preclinical stage, but to actually get all the way to a phase 3 and get an approved agent, it's a very small number, which is why pharmaceutical companies need to spend and devote a lot of money to research and development. Advance there. There's only a couple slides left, I think. Yeah. So I mentioned this already. This is just the big, levels of evidence. We put randomized control trials at the top and expert opinion at the bottom. But again, they're expert opinion pieces that can actually hold a lot of weight if there's not enough evidence, but it's based on real expertise. So you have to take this, with some balance. Let's try advancing. Okay, so another very nice paper. This is looking at basic notions for peer review of scientific articles. And it's this long, detailed table, but there's a really nice quote I pulled out from this paper. He says, as for a general assumption, no single and validated approach exists to peer review scientific articles. Nevertheless, some simple concept gathered after years of experience may help perform this vital activity according to objective and fair rules. And he has this long, detailed table of rules. More or less like writing scientific articles, and again, it's exactly what I said from the beginning. Reviewing and writing, they're just two sides of an equation. But he says, more or less like writing scientific articles, the activity of refereeing is an ongoing learning. The more you experience, the more you learn. Therefore, I really hope that some notions reported in this dissertation may be a guide or a help, especially for young scientists who are willing to be engaged in peer reviewing scientific articles. So, really nicely written. Next slide. This is just the suggested template. So there's no right way to write a review, and I've seen it done a lot of different ways. But generally, I think this is a very good outline. You start with one or two sentences that are just sort of summarizing the study. Like, I reviewed the paper. Here's what I understand about it. Maybe I even say I commend the authors for doing X, Y, or Z if it's something that was somewhat unique or interesting or just important for the field. It's totally fine to do that. Doesn't mean you're not going to be critical later. You give some basic overall impression, maybe like big picture concerns and or why you think it's actually really good. And then you typically will get to like very specific point-by-point responses. And I'll have maybe I number them, sometimes a little bit lazier and I just use a little hyphen or something, but something that's going to have things in a good, organized, structured way for the authors to read when they get the review back. Your recommendation specifically, I would argue, should not go in your review. A lot of reviewers will do it, but I wouldn't do that because you're just providing recommendations and the editor is going to make a decision. So it can be a little bit off-putting. If, let's say there's 3 reviews, 2 of them are reject, 1 of them was major revision, but the person who wrote the major revision review actually states this paper should be accepted, this paper ultimately should be accepted for publication. Because they're going to get that review back and the paper got rejected. But if you had major revision as your recommendation and you simply just didn't say this should be published, I mean, you have no way to interpret it. Maybe you wrote all those detailed comments of things that need to be corrected, but ultimately what you recommended to the journal editor was, I wouldn't consider this paper. But the authors don't need to know that. All right, we're going to run out of time. Last slide. So, in summary, I would say that writing, editing, reviewing, they're all interrelated. Like I said, they're all sort of different sides of the same one coin, so to speak. And like that quote, it's very much a spiral staircase of learning and experience, like so many things we do. So thinking about like the first time I was involved in writing a paper, doing a mock review as a resident, doing a review, working on a higher level paper, being the primary author, having to be the one that drafts the response to the reviewers. Like each one of these steps, you just keep building and growing. And nobody just like starts from the beginning and saying, oh, now it's time to do this. Okay, done. This is not that easy. You have to read, and you have to read critically. So just reading is not enough. You have to read and really think about what you're reading. And I mean on a regular basis. so that you take that into how you do this, even when you're doing your own writing, let alone reviewing something. And I would say that, and I said this before, skepticism is healthy. Like, assume that everything is wrong. In general, I would assume things are wrong. Be proven that it's right. It shouldn't be hard to prove that something's correct or done in a good manner. Serving as a journal reviewer, I would argue it's an important service, and it's really part of the give and take of our profession. So if you publish, you have to serve as a reviewer. You have to. And it's why I've been very happy now for years, over 10 years, 10 to 15 years probably, to serve on the IRB. Because for my level of expertise at the Cancer Center, we have a scientific review committee also, and they're reviewing like the scientific validity of studies. I accept who I am. You know, I'm an oral medicine specialist at the Cancer Center. I don't have the level of scientific, like, gravitas and expertise that many of my colleagues there do. So I'm not going to move to that committee. But we do research. I do research with cancer patients. You know, I know that when we submit, others are reviewing our documents and so on. So it's my service to the institution and to the greater sort of field to serve on that committee. It's the same thing with this. And finally, just professional development, continual growth is very much part of the process. So even when it seems really painful sometimes, presumably we're learning something. So thank you. Hopefully this was interesting, not too confusing, because like I said, you take one topic, but each thing just leads to the next one. So you can't really just think about reviewing versus writing versus editing. I'm happy to answer questions or not.
Any questions from the audience? No. No questions?
Any YouTube questions?
Here. I have to check the YouTube.
Yeah, there's a question.
If you would give this lecture in 10 years again, would you expect some important updates or maybe these messages?
I don't know, it's a good question. What do you think? You've been doing it longer than me. So, you know, you have more of a 10-year perspective than I do. My personal opinion would be is nothing's going to change very much.
Not much. Just maybe they create algorithms using AI to
make everybody's jobs easier.
Review, yeah,
to make everybody's jobs easier.
Yes.
Maybe even prepare you with an AI produced summary that helps guide your review. But I don't know. Yeah.
I don't see this as a threat for the process, but I see that as a threat to critical thinking of humanity.
Yeah, I agree. And me personally, I wouldn't want an automated summary to be provided to me. I want to read what they gave me and read it the way my brain is processed to read things. But again, I'm also reading. I'm born and raised in Chicago, Illinois. I speak English.
People now are starting with this AI reality.
Yep. So we'll see.
Matt, I would like to listen from you your experience with journals that authors pay for the journal to publish, but the journals don't pay for the reviewers nothing. How do you deal with this? Do you agree? What are your opinion?
I don't
with this kind of journals?
I don't have a strong opinion. I mean, at the end of the day, whether somebody's paying for journals to be published, right? I mean, there's a cost, and whether the money's coming from the authors versus from some other source, advertising. I mean, there has to be a cost. I'm not aware. I mean, there's so few situations where I've ever been offered an honorarium for reviewing something. It's usually been some government council. They have a research grant, and they ask you to be an expert reviewer, and we're going to compensate you with some small amount of money, but not for reviewing journal articles. I don't really have a strong opinion about it. I think as there were more and more, you know, pay-to-publish journals, my initial impression was that, like, these all must be complete garbage, right? Like, it can't be a good journal. But I don't believe it's entirely true. I think there's plenty of very good work that's published in, you know, open access, like, you know, paid publications. And I've been involved with one of the, you know, Frontiers journals, and there's some really good work published in Frontiers. But some of the journals can be tough to work with, and we've had some experiences with, you know, something we're working. It's just sometimes they seem to function a little bit differently, you know, than the journals that you're not paying, or you don't have like a, you know, your token that's being paid for.
And other questions? Another one, for example, you are a leader in your community, in our community, in neuromedicine. So probably you receive a lot of invitations to review. What
Yeah.
makes you, what is the
Perfect.
points that you?
Yeah, like I said, if I don't feel like there's anything about me specifically that's going to do this better, and I don't care that much, I shouldn't say yes to it. You know? If it's something that I actually find really intriguing, and I don't really have time for it, I'll say yes because it's my duty. You know, like if I'm the one that's going to review this critically better than anybody else, then I need to find time to review it if I think it's important enough. And it depends on who the invitation comes from and the journal as well. So like I'm totally behind in a lot of just things in general right now. Like I need to finish that paper that's driving me crazy, so that because I have 2 more I need to edit, and one of them's also going to drive me a little bit crazy. So I know I have a lot of work ahead of me, but I just accepted a review invitation from Transplant and Cellular Therapy because that used to be biology of blood and marrow transplantation. I've published in that journal several times. It's a really high-level journal for stem cell transplantation and cellular therapies. So when somebody of prominence has recognized that I have the expertise for whatever, like, I can't say no.
It's very simple. Any other question?
All right, you guys have a lot of reading to do, because if you got all those references, I'm telling you, like, every paper is a gold mine of information.
And of course, to be a good reviewer, you have to be a good writer too.
And you have to, and like I said, you have to read. You have to read. That's the most. You can't be a good writer without reading.
Yeah. And I think that as a professor and researcher, I can say that I learn a lot from the review process all the time. And I think that is a very good opportunity to us sometimes to be in front of very good papers that will change the things ahead. We are discussing about the new classification of oral leukoplakia. I remember that I had the opportunity to review some very good papers that have been used for this new direction.
Yeah.
So
You see,
we
you
are
take a
in
little
front.
bit of pride in
Sometimes
that.
you are doing the review process. You are in front of all the modifications that everybody will see after.
But you take some pride in it too.
Yeah,
right?
it's very good. It's very, very good. Nat, we have a special moment now. Professor Susanna, she has a gift for you that was designed and made by our colleague that you have the opportunity to meet. Clarissa gave us a ride other day from the university to a restaurant. So,
Thank you
Professor
in
Marcus,
advance, but whatever it is, it's not necessary.
no, it's our pleasure to have you here with us celebrating this very special moment. We are very happy to be part of this university. I undergrad here, I was an undergrad student here and now professor, and all of us, we are very happy to have you here representing our oral pathology and oral medicine group in this activity.
I'm happy to be part of it too. Thank you.
I would like to give you a simple gift.
Beautiful.
It's our School of Dentistry made by Clarissa.
It's a
And it
print.
will be a memory of our dental school. So thank you so much.
It's amazing. Thank you so much. Is it a print?
I don't know what
Watercolor.
Watercolor.
Original watercolor or print?
It's a print.
Print, yeah, print. Beautiful.
I will
will frame
do
it.
something,
Yeah,
yeah.
I'll frame it as
And
well.
then, I think that I have a frame here just for you.
Just for, yeah. It may be better, it may not be that, I can put it in my, let me see if my bag.